Welcome to this presentation produced by physiotherapists at Swansea Bay University Health Board. This presentation talks about a common condition known as lateral elbow pain. It has been produced by Alice Mayo, Oshan Griffiths and myself, Josh Williams. This presentation covers advice on managing lateral elbow pain based on current national guidelines and research. Such guidelines are produced by the National Institute of Health and Care Excellence, or NICE for short. This body collates the latest high-quality scientific research to aid healthcare and social care professionals within the United Kingdom. We will also try to answer some of the more common questions that our patients ask about their lateral elbow pain. In this presentation, we will also discuss what happens when you have lateral elbow pain, what are the treatments available for it, what is the role of exercise in lateral elbow pain, and some useful additional resources. So in this slide, we will cover some basic anatomy of the elbow. The most common cause of lateral elbow pain is a condition called tennis elbow. This is also known as lateral epicondylitis. Lateral meaning the outside. At the top we've got the humerus, which is your funny bone. Then you've got the elbow. Your elbow meaning inflammation of. This is your lateral epicondyle. So this is just the outside of your elbow. Inflammation on the outside of the elbow. You've also got the extensor muscles is a tendinopathy forearm. So the extensor muscles that are highlighted here are the muscles tendinopathy being the condition where the tendon and your fingers becomes in an upward direction, irritated. So an example of this would be overload or repetitive use. So if you put your arm out and you lift your fingers and your wrist from your elbow to the muscle bulk in between the lateral muscles, which are responsible for bringing your hand and you've got the tendon. Also, the tendon is a bit of tissue that becomes sore and inflamed to muscle. Despite its name of tennis elbow, fewer than 10% of cases are actually caused by racket get sore. The main cause of tennis elbow is actually normally due to overuse, gripping, or overload of the extensor muscles of the forearm. So here are some risk factors that put you at a higher risk of developing tennis elbow within your lifetime. So being aged 30 or older, being in a manual job, for example, doing a job that involves lifting or repetitive movements, being a current or previous smoker. We know that that has an effect on the way the body can regenerate cells and repair itself, having an increased body mass index or being obese, or taking medications such as fluoroquinolone, antibiotics or statins. What else could my elbow pain be? Despite the tennis elbow being one of the more common causes of elbow pain, there are of course other conditions that can cause similar symptoms. Osteoarthritis is mild degenerative change of the elbow's cartilage, and typically osteoarthritis causes stiffness within the elbow joint that lasts less than 30 minutes and is worse first thing in the morning. There is also a loss of movement when bending and straightening the elbow, often caused by pain and stiffness in some cases of osteoarthritis. Trauma and interarticular loose bodies. Elbow stiffness, deformity, swelling, heat, redness, or soft tissue damage may indicate old or new traumatic injuries. Intra-articular loose bodies, meaning loose bodies within the joint space of the elbow, can cause severe pain, clicking, or limitation in the amount of movement in your elbow. Cervical radiculopathy. This is a condition where pain is referred from the neck into the arms or the hand, often causing muscle weakness, neck pain, and potentially pins and needles and numbness. Golfer's elbow. Golfer's elbow presents very similar to tennis elbow, however, symptoms are located on the inside of the elbow. This is because the tendons that become sore are the ones responsible for bending the wrist and the fingers. Unlike tennis elbow, these tendons attach to the inside of the elbow, hence why the distribution of pain feels slightly different to tennis elbow. Cubital tunnel syndrome. This is an entrapment of the ulnar nerve at the elbow, which may lead to numbness and tingling along the ring and little finger. And lastly, radial tunnel syndrome. This is an entrapment of the radial nerve at the elbow, which may lead to numbness or tingling along the thumb, index and middle finger, as well as weakness in the thumb and wrist. This can occur alongside tennis elbow, so it is important to present your symptoms and your signs to a healthcare professional in order to have an accurate diagnosis and therefore accurate treatments. What are the common symptoms of tennis elbow? Firstly, it's not uncommon to experience tenderness on the outside of the elbow, pain when writing or typing, pain when lifting objects, pain when gripping, pain when extending the elbow, which is straightening the elbow and wrist, pain when turning your forearm, so that twisting rotation movement of your elbow. Diagnosing tennis elbow. A large part of the diagnosis will come from your history of injury. Your healthcare professional will likely ask you about how your symptoms first came about, distribution of your symptoms, and also ask you what makes your symptoms better or worse. Common signs for diagnosing tennis elbow include tenderness on the outside of the elbow. Tenderness will typically be localized to the lateral epicondyle or the common extensor tendon, as mentioned in the previous slide on anatomy. Pain on repetitive activity, for example writing and typing. Pain on resisted wrist and elbow extension. So this is a physical test where your clinician will get you to straighten out your elbow and lift up your wrist and your hand and do it against some resistance. This normally causes pain. It's exactly the same with pain on resisted middle finger extension. Exactly the same, your clinician will ask you to straighten out your elbow, lift your middle finger and put a little bit of resistance on it. Typically with tennis elbow this will cause pain also. Here we have what's known as the cycle of symptoms. As discussed earlier, pain is one of the most common symptoms of tennis elbow. It is this pain that can lead us to becoming quite fearful of doing further harm during certain movements and tasks. This fear can lead to withdrawal from activities, which in turn can lead to weakness, simply because we're not using the muscles and the tendons as we were previously. Weakness within the forearm muscles often leads to more pain. This is because when it comes to doing those activities once again, the muscle becomes deconditioned and weak, putting extra strain on the tendon, which leads to the pain and the flare-up of symptoms. This cycle may continue. It is important that we try to break this cycle in order to speed up the recovery process. So what are the treatment options for tennis elbow, and how can we break that cycle of symptoms? Well, there's exercise, symptom modification, pain relief, corticosteroid injection, and shockwave therapy. We'll discuss all the treatment options in the next few slides. There is a lot of literature and there is a lot of research to show that exercise therapy is the most effective therapy and treatment for treating tennis elbow. Studies have shown it significantly reduces pain, significantly reduces sickness and sick days when it comes to tennis elbow, reduces the likelihood of further interventions or reoccurrence of tennis elbow. It shows that it speeds up the recovery and helps with everyday activities. So one of the most common questions that we get asked when talking about exercise and tennis elbow is how to exercise safely and easily. How much is too much exercise? I think we've all been there where our symptoms, for example, of tennis elbow are under control and we're having a good day. So we tend to do loads and loads of exercise and it tends to sometimes flare up the symptoms. We think, why on earth did I do that? So hopefully on this slide, we'll talk a little bit more of how we can exercise safely and grade it in a good way. So you have to start somewhere and always start gently and slowly. If it hurts a little bit, don't worry. That's to be expected when doing tennis elbow exercises. But if it hurts for more than 1 hour after exercises, adapt. Reduce the amount you do. When the pain comes back to normal, start to build those levels back up slowly again. And finally, build up. Build up the repetitions, build up resistance, and build up the amount of time you do in exercises very slowly and in a graded fashion. And this will enable the tendons and the muscles to become much more used to coping with loads, and you're building that load up slowly over time. So when it comes to doing that activity, for example, your gardening or your work or whatever it may be that causes you symptoms, your tendons or your muscles are a lot more resilient to be able to cope with that load. Isometric exercises. Isometric exercise has shown to be effective in the acute stages or the early stages of tendon pain. For example, tennis elbow. Now, isometric exercises are exercises where you're trying to contract your muscle without necessarily moving your wrist or your hand. So an example of this, and this is just an analogy, if you can imagine pushing against a wall. Now, hopefully, the wall's not going to go anywhere and you're not going to go anywhere. Okay, so you're pushing against something that can't really be moved. But you should still feel your muscles contract. And this is exactly what you want to try to achieve with these exercises. So for example, you can see isometric wrist extension. This is where somebody in the diagram has their elbow at 90 degrees with their palm pointing to the floor and their back of their hand in contact with a desk. And what they're doing is trying to pull their hand and their wrist in an upwards direction against the desk. Hopefully the desk is not going to move, and neither is their wrist. But they should still feel a contraction down their forearm. Now, you can see similar exercises with isometric supination and isometric pronation, exactly the same, but instead of pushing the wrist in an upwards direction, they're trying to twist the hopefully unmovable object. So you're trying to get that static contraction. Now, for all isometric exercises, a good starting point would be to complete 5 reps of 5 to 10 second holds twice a day. So you want to try to hold the contraction for 5 to 10 seconds and complete that 5 times, and try that twice a day. As these get easier, you can increase the number of repetition and you can increase the amount of hold and time you hold in the contraction. Lastly, you can see what's called the pronator stretch. This is where you stretch out the muscle, it's not necessarily strengthening the muscle. You straighten out your arm, okay, and you bring your hand backwards as the diagram shows, and you're trying to hold that stretch for 20 to 30 seconds. Don't push it into pain, just a little bit of discomfort, a bit of a stretch, and repeat 2 to 3 times. So the next form of exercises are exercises whereby you are going through the range, the full range of motion of your wrist. So unlike those isometric exercises where you're not really moving your wrist but you're still contracting the muscle, in these exercises you're going to be contracting the muscle and moving the wrist through its range. An example of this can be seen in the second diagram. So someone is holding their hand over a table with a small weight. Now this small weight may be a tin of beans or a bottle of water or a small hand weight. And what they're doing is bringing their wrist in an upwards direction, so contracting the muscle, and on the way down, you can see labeled number 2, they're going to go down really slowly and really controlled. And the slower and the more controlled that movement on the way down, the better. A real good starting point is that we would recommend 3 sets of 8 twice a day. Again, like the isometric exercises, if you feel these are becoming a bit too easy or you want to progress, increase the repetitions or increase the amount you do throughout the day. There is a few exercises you can clearly see on the next couple of diagrams. A quick slide now on exercise versus pain. You may have been completing some of the exercises as discussed on the previous slides. If so, you may have experienced some degree of pain or discomfort and may be asking yourself, am I doing the right thing? Should I continue to do these exercises? Should I ease off or should I stop altogether? A clear way of knowing how much is too much is using this traffic light system. Firstly, imagine your symptoms on a scale from 0 to 10. 0 being no pain at all, 10 being the worst pain imaginable. If your symptoms are between a 0 and a 4 while exercising, you are in the green zone. This is a safe zone to be in while completing your exercises. If this is the case, then carry on and progress as best you can. If your symptoms are between a 5 and a 6 out of 10 on the scale, then you are in the orange zone. So proceed with caution and listen to your body, and if you feel that pain goes up to a 7 out of 10 or higher, then consider it stopping or easing off. If you get sharp, intense, severe or radiating pain, consider stopping altogether and maybe regressing the exercise, A, to a different exercise, or B, having a little bit of time off and coming back to the same exercise but reducing the load, reducing the sets and the reps. Pacing activity and exercise is really important when talking about tendon pain and tennis elbow. Naturally, when our pain levels are under control, we feel that we can do a lot more. This often leads us to doing more of the things that have originally caused our symptoms, whether this be work in the garden, typing on the computer, playing sports, or so on. So I'll illustrate my point using this graph. On Monday, you can see that this individual did a lot of gardening. This may have increased the symptoms of their elbow pain, leading to an inability to undergo the same activity the following day. In this case, pain was so bad that the individual required a rest day before the pain came under control. Wednesday, they made the same mistake of overdoing it, resulting in even more symptoms and pain and even more time away from the garden. This trend of fluctuating levels of activity continued to repeat itself. The next slide, you can see a much better example of how pacing should be done. Monday, they started off with a sensible level of activity that they were able to complete and they knew they would be able to do fairly symptom-free. Over a period of time, they sensibly increased this level of activity building confidence and strength, and leading to more time in the garden and less time in pain. Pain relief may be very useful in reducing your symptoms. Paracetamol and anti-inflammatory gels, such as ibuprofen gel, should be used as the first line of pain relief for symptom control. Anti-inflammatory gels, topical anti-inflammatory gels, may be beneficial in improving pain, particularly within the first 4 weeks of a flare-up. Now, some people may suffer skin rashes when applying these gels, so it's really important to check with your GP or your pharmacist before taking any medication. Symptom modification. The National Institute of Health and Care Excellence, NICE, have created guidelines to suggest modifying any activity that can cause symptoms in the short term whilst maintaining activity where possible. Avoiding lifting heavy objects, forceful or twisting actions that may aggravate symptoms. If lifting a heavy object, do so with the elbow bent and the palm facing upwards rather than picking the object up with a straight arm. If you feel that your symptoms are due to work, discuss with your employer or your occupational health department. Options may include mixed working patterns, increasing the number of rest breaks, changing the way objects are handled, for example, the shape of your mouse or keyboard, and to make other modifications to the work environment. Other considerations to take into account are ergonomics. If your elbow pain is exacerbated by activities such as computer work, then altering your sitting position and position or shape of your keyboard or mouse may help to ease your symptoms. A tennis elbow brace is a way to ease pressure on the tendons while keeping active, and reducing or cutting out smoking. Smoking negatively impacts the way your body heals, which can delay recovery times. Giving up or reducing your habit can improve your recovery. Corticosteroid injections. A corticosteroid injection is an anti-inflammatory injection, but it's a steroidal anti-inflammatory injection. There is strong evidence to show that a cortisone injection may lead to a reduction in pain in the short term. However, there have been many studies to show that cortisone injections can lead to a slightly worse outcome longer term when compared to other treatments such as exercise or even a wait-and-see approach. Therefore, cortisone injections are not routinely given as first treatment. Shockwave therapy is a treatment that uses high-energy acoustic waves which can accelerate tissue repair and cell growth. There is some debate on how effective this is when treating tennis elbow compared to other proven treatments such as exercise, and it can be slightly uncomfortable to receive. However, it is available in Swansea Bay University Health Board Physiotherapy Department if recommended by your physiotherapist. So, in summary, lateral elbow pain is commonly diagnosed as tennis elbow. Tennis elbow should be treated with exercise and strengthening as the first line of treatment. Modifying provocative activities also helps. Lateral elbow pain often improves spontaneously, and it is said that up to 80 to 90% of people actually recover from tennis elbow from a 1 to 2 year period. However, we know that exercise can accelerate this process and actually prevent reoccurrence. Thank you very much, and thanks for listening and watching. Below you will find some useful websites to do with tennis elbow. Thank you very much.